Hey everyone, thank you so much for tuning into the recording today. Today I've got the privilege of talking to Dr Nate Lighthizer and Dr Kelly Malloy, and we're going to be talking a little bit about SRC Melbourne, which is 8 weeks away today. It's coming right up really quickly. So if you don't know who Dr Lighthizer and Dr Malloy are, Dr Nate Lighthizer was born and raised in the Bismarck area of North Dakota, and he's a graduate of the Pacific University College of Optometry. On graduation, he moved somewhere much warmer, and he completed a residency in family practice optometry with an emphasis on ocular disease through the Northeastern State University Oklahoma College of Optometry. Dr Lighthizer has since joined the faculty at the Oklahoma College of Optometry, and he serves as Chief of Specialty Care Clinic and the Chief of the Electrodiagnostics Clinic. In 2014, he founded and now heads the Dry Eye Clinic at the College of Optometry, and he was recently named Director of Continuing Education, as well as the Assistant Dean for Clinical Care Services at the Oklahoma College of Optometry. He's a founding member of the Intrepid Eye Society, a group of emerging thought leaders in optometry who promote excellence and growth in the field. He was recently named to Primary Care Optometry News member of the Peakon 250 list, which is a list of the top 250 optometrists in the United States who practice progressively, provide innovative patient care, and contribute to optometric research and excel in academia and share what they've learned with other optometrists to advance the profession. Dr Lighthizer lectures nationally on numerous topics, most notably the advanced ophthalmic procedures, electrodiagnostics and ocular disease. So welcome, Dr Lighthizer.
Thank you for having me. My pleasure to be here.
Great. And Dr Kelly Malloy is an associate professor at the Pennsylvania College of Optometry of Salus University, and she specialises in neuro-ophthalmic disease. She's the director of the Neuro-Ophthalmic Disease Specialty Clinical Service at the Eye Institute and has achieved diplomate status in this specialty at the American Academy of Optometry. Aside from her clinical patient care responsibilities, she also teaches the head and neck anatomy, neuroanatomy and neuro-ophthalmic disease courses at Salus. So welcome, Dr Malloy.
Thank you very much.
That's great. So let's start off with some short questions first. So, Dr Lighthizer, phoropter or trial frame?
Phoropter or trial frame? I'm going to have to go with a phoropter on that one, but usually I let my students choose that one, so they often are going to make the choice of that one. But a phoropter or trial frame, we often do the phoropter on that one, so I'll choose that.
Phoropter, love it, yes. Dr Malloy?
I would say probably most often we use a phoropter as well, although sometimes dealing with neuro-ophthalmic disease, we have people that, need special prism in their glasses, and it's hard to trial frame. It's hard to do that in a phoropter, so often we use the trial frame to kind of hold up all different prisms and see what they like. So I think both are good. They both have their own uses in certain patient circumstances.
For sure, yes. And Dr. Lighthizer, electronic or paper medical records?
Records, boy, that is the $1 million question. And, we obviously all choose electronic. We're forced to choose electronic health records for the most part on that. We have converted to that over the last few years, and we're very happy with our electronic health record, Revolution EHR. But I think if we had the choice, I hear from a lot of our doctors that they would much rather be on paper, or much more efficient doing an exam on paper. So I think if we had the choice, we'd be on paper, but it's a forced choice of an electronic health record.
For sure. And Dr. Malloy, electronic or paper?
Pretty much exactly the same thing. We are forced to be on electronic medical records, and most people do feel more efficient on paper. And there are the times the electronic record just goes down in the middle of the day, and then you're forced to switch to paper. So,
Absolutely.
yeah.
there's nice aspects of electronic health records, being the legibility of records, things like that,
That's
being
true.
able to share images and data, etc. But yeah, I think we'd choose paper, a lot of us, if we had the choice.
And then again, we know both ways because we started on paper. The newer doctors coming up, they just think that's the only thing. They have never seen paper records. So, when the days that it goes down, they don't like it. So it's just a matter, I think, of what you started with as well.
Absolutely. I'm a bit of an Apple geek, so I've got an Apple Pencil and I love drawing with it. So it's pretty cool. OSDI or speed grading for dry eye. Dr. Lighthizer.
Boy, I've used both. Currently, we use the speed questionnaire. I actually have multiple questionnaires that we use in our dry eye clinic. One of them is the speed questionnaire, to just give you that quantitative data, how symptomatic they are on the various symptoms, symptomology, etc. So it is the speed one. It's one I currently use, but I have used both, and I think a questionnaire is absolutely essential when you're managing dry eye to get an idea of different aspects of their disease, their demographics, etc. Just helps to focus the doctor when you're managing dry eye, to remember to hit all those different things, because there's so many things involved in dry eye, multifactorial, things as simple as having a ceiling fan in their room. That's one of our questions on our questionnaire is, you got that miserable dry eye patient, they probably should turn the ceiling fan off in their room, along many other things, but questionnaire is essential.
Absolutely. Very, very subtle things that can make a big difference to someone's life. And Dr. Malloy, OSDI or speed?
Well, again, I think both are great. And myself in my practice, I specifically deal with neuro-ophthalmic disease. So, we have a separate practice in our office that is dry eye, and they handle that and do a lot of the questionnaires. I'm dealing with people that come into me because they're having double vision or pain or sudden vision loss. So I'm not really doing the dry eye questionnaire myself on a regular basis.
For sure, yep. And welcome to Dr. Darryl Glover as well, and he's voted for OSDI. So thanks for joining us, Dr. Glover. And Dr. Malloy, I might start with you on this one. Do you prefer a pen flashlight or a Transilluminator?
A Transilluminator, definitely. Yes. It's a brighter light, a more focused light. And when you're checking pupils, it's very important to make sure that you're getting that focused light right into the pupils. And I've seen, times when people are using a flashlight, more of a regular pen light, that they can miss subtle pupil findings. So I definitely feel that a Transilluminator is superior.
For sure. And Dr. Lighthizer, what do you prefer?
I agree 100%. That pen light has so much diffuse light. You can be shining this eye, it tends to get over here as well. So yeah, it's got to be the Transilluminator 100% on that one.
For sure. And Dr. Malloy, when you're writing letters, do you prefer dictation or do you like to type them out yourself?
Well, I've done all of the above, depending on where we were in our electronic records or on paper. But the way we do it now is, since we're doing electronic records, we kind of turn that into a letter. So we put the history as terms of like paragraphs in the assessment plan, kind of in paragraphs, and then it kind of just prints out all the exam data somewhere in the middle. So that's what we do at this point. But, I've done all of them, and I think all of them are pretty equal.
And Dr.
I think it's just very important to tell doctors to write letters. That's definitely the key, because it's important to keep all the doctors, all the different specialties in the know of what's going on with the patient's eyes. It really makes a difference when everybody in the medical community is working together.
Absolutely. It really makes a difference for patient outcomes. That's great. And good collegiality as well.
Yes, definitely.
And Dr. Lighthizer, do you like templates and using templates yourself?
Yeah, you took the words right out of my mouth. That was going to be my first statement, is definitely you need to do letters, whether you dictate them, whether you type them. I personally type most of my letters. Our EHR, we're working on that to get that so it kind of pulls a letter out of the record, but I personally type them. We do a lot of letters in our electrodiagnostics clinic, and we have patients referred in. I had a patient from 7 hours away on Monday this week from a doctor, testing for retinitis pigmentosa, cone dystrophies, among many other things, retinal disease, unexplained vision loss, neuro stuff as well. So we type out our letters, but I think it's critical for optometry when you're seeing that patient. Maybe they're a diabetic, maybe they've got a vein occlusion, high blood pressure, or you're seeing signs in the back of the eye. Communicate that back to the PCP or other doctors to let them know what you're doing and what you're capable of to promote the profession and further the profession of optometry. Those letters to every primary care doctor saying, I've seen your patient, I've dilated the eyes, no signs of diabetes, or I saw signs of high blood pressure in the back of the eye, just to let them know what we're doing.
Right, and even, it's good to send it to the primary doctors, but even to all the specialists that they see, because once they get the letter and they realize, again, what we can do, you'd be surprised how many referrals you get from those other specialists as well.
And you'd be surprised how many go, oh, I didn't know you guys did that or could do that, or you have that testing. So let them know.
And it'd be amazing if you could say, yeah, I picked up a Hollenhorst plaque in the back of the eye and I recommend that you organise a carotid Doppler or something like that. So, yeah, it's great to promote optometry that way. Yeah.
Yes.
So, Dr. Malloy, when you were studying, what was your preferred learning type? Were you visual or auditory or kinesthetic, sort of hands-on?
Good question. Boy, it's taken me back a while here. I think it was a combination, actually. I think auditory, definitely going to the lectures and hearing it once the first time, definitely, put that information kind of in your head to start with, and then studying it, made it a little bit more clear. It's interesting now. Back when I was a student, there was no alternative. You went to class and you heard the lecture. Now, all the lectures are recorded and the students can watch them whenever they want. And they also have all of the notes on PowerPoint, right there readily for them. So everybody has, I think, learning styles are different now because there's so many different options. When I was a student, there really weren't as many options. So it was, you went to class and you learned that way. And when I went to class and took notes, so the actual writing of it and hearing of it at the same time is really kind of what helped. But I see that things have definitely changed when I see the way that my students are now.
For sure. So listening to it was important for you.
Yes.
Yeah, for sure. And Dr. Lighthizer, how do you like to learn best?
So for me, definitely hearing it the first time and hearing an expert, like if I was taking Dr. Malloy's neuro class, to be able to hear her perspective the first time, I think is imperative, very, very important. For me, after that, I'm a very visual learner. I have the paper, the notes in front of me, and I could remember, okay, that slide was on the left side of the page, the middle slide. So I was definitely very visual when it came to that. My wife is an OD as well, was a year ahead of me. Always made fun of me going, how do you remember which slide that was on which part of the page? I was obviously a visual learner. That's how I remembered that. Auditory, not as much, even though I like to hear the experts. I think that's the starter. After that, I was a visual learner.
That's awesome, and I've heard that using colours can help you remember where things are and help make sense of it too.
Yeah, definitely.
Yeah, for sure. So, Dr. Malloy, when you go on vacation, are you someone who likes to totally chill out, sit on the beach, or do you like to try and explore everything and crash at the end?
I like to explore things, definitely, especially if it's a location I've not been before. I like to see the sights and see what's going on, look for things that are new and do things that I haven't done before. Sure,
yeah, try and experience everything.
Yes. Yeah.
Absolutely. And Dr. Lighthizer, what do you like to do?
So I think I'm a little bit of both on that one. We were in Hawaii a couple years ago with the family, and I was content laying on the beaches of Hawaii all day long and just relaxing. It's pretty nice. But I also like to get out and see different areas. We were in New York City for Vision Expo East, and being able to go see the different sites of New York City, and you're exhausted. At the end, you need a vacation from your vacation at that point. So I've went both ways, but if I had to choose, I don't mind laying on the beach all day long and just relaxing, watching the waves come in. That's kind of nice.
Sometimes it's just that peace of mind, and when you get energy again, you can go out. It's a good mixture.
Yep.
Yeah, for sure. So, Dr. Lighthizer, you've been to Australia. You came out last to SRC in 2016. Is that correct?
Correct. Yep.
Yeah, for sure. And so, some of the things that are you planning to, explore anything differently this time, or check out any places, or is it a relatively brief visit this time?
It's a relatively brief trip. I think I land on Wednesday, and the conference is Saturday, Sunday. Is that Saturday, Sunday?
Yep.
So I've got a couple days before. Last time, Jeff Gerson and I, we went downtown in Melbourne, and they had a great big festival or market going on. We sampled different foods. So I'm kind of looking forward to doing that again. So just kind of seeing the different areas in downtown Melbourne. So that's kind of what I'll be doing.
For sure. Yeah, there's some awesome places to check out, and some great coffee shops as well. So, yeah.
Yep.
And Dr. Malloy, have you thought about do you like to be more in the city, or do you like to travel outside of the city? What do you hope to do in Australia?
Well, I mean, since I've never been to Australia, anything I do is going to be something new, so that's great. So I definitely plan to see Melbourne, and I'm taking a little bit of extra time, so I hope to be able to get out and see some of the more other areas as well. I don't know yet what I'm going to do. I'm still looking into it. Probably take a few tours. Definitely want to see some kangaroo and koala. I have to. I'm in Australia, right?
That'd be great. I'm sure there'd be some members who'd love to take you out there. So, yeah, that'd be good.
Yeah, that'd be great.
Yeah, for sure. So, Dr. Lighthizer, what's one of your favourite foods?
Boy, one of my favorite foods. That's a tough question. I'm a seafood guy. I was born and raised in Bismarck, North Dakota, so you'd think, red meat would be my thing. Like steak and things like that. But I've really grown to like seafood. Lobster and crab and things like that. So if I had to pick, a good piece of salmon or a good piece of crab, it would be one of my top. Seafood is probably my favorite food. Now, when it comes to snacking, though, I'm known from my family and friends as the guy that can't put a potato chip down. You give me a bag of potato chips, and I bet you can't eat just one bag is probably my philosophy on that one. So,
I was going to say, bet you can't eat just one chip.
To me, that's the slogan, right? Bet you can't eat just one. For me, it's just one bag. So.
Dr. Malloy, what's one of your favourite foods?
Oh, wow. Again, just like Nate said, I really like seafood as well, so hopefully there's some good seafood in Australia. I would think so. And also I like lots of fruits and vegetables, so everybody's always laughing at what I take for lunch at work, because I like sweet potatoes, so I take a sweet potato to work often, or an avocado. I take an avocado, so I open my bag, and everybody says it looks like you're taking a fruit stand out of your bag. So, but I like lots of fruits and vegetables.
It sounds very refreshing and good energy for the day. Yeah, for sure. And thanks very much for joining us, Rick Good. Appreciate you being here today. And I just wanted to talk about. So, tell me, Nate, do you drink coffee?
I actually don't. I am not a coffee drinker. I've never acquired the taste. It smells amazing.
Yeah.
I'm not a warm beverage guy, so I'm not a coffee drinker. I do make it wonderfully, though. At least my wife tells me in the morning when I'm making her coffee. So.
For sure. What's your preferred drink then? What if you were to make a drink? What would you make?
Mostly water. I drink a lot of water. I've tried recently to kind of cut out the carbs and sugar, so I don't drink a lot of juice. That's a lot of sugar in the juice. So it's water, occasional glass of milk, but not very often. And so mostly water is what I drink with a glass of red wine occasionally, or maybe a tall beer every once in a while as well. I'm a big IPA fan, as well. So water is mostly on a daily basis what I drink.
Awesome. And Dr. Malloy, do you like coffee?
No, I don't like coffee either. Just like what Nate said, I like the smell, but every time I go to try to taste it, to me it just tastes burnt. So I just don't like coffee. I also drink a lot of water.
Yeah.
Sparkling water or seltzer water that's flavored, I drink a lot of that as well. And awesome. Tea, I'll drink hot tea.
Okay, any particular types of tea, like herbal tea or regular tea?
Lately I've started drinking something called turmeric tea. So it's turmeric with some black pepper and cinnamon and ginger. It's very good. With a little honey.
Yeah, turmeric is a wonderful wonderful molecule. It's just how it's a good lifting agent. So yeah.
Yeah.
So Nate, just thinking about optometry, what do you find inspiring about optometry? What gets you out of bed each day?
Sure. Well, I think this is a particular passion of mine is the way optometry has evolved, and we are an evolving profession. We're constantly changing. You think of optometry, 40, 50 years ago, it is a wonderful profession, but we were glasses and contacts, and we still do that wonderfully well. But really, dilating drops weren't around 40, 50 years ago for optometry to use. And then now that the scope of practice has evolved tremendously over the last 2, 3, 4, 5 decades. And, that's something that hits home for me in Oklahoma. The scope of practice that we have here with injections, the ability to remove lumps and bumps, do biopsies, certain procedures that we do, laser procedures. So it excites me to know that optometry has really evolved into a medical profession. We are definitely a medical profession. The things that we treat, that we manage, and as we continue to evolve, who knows what the future will hold for optometry. As the baby boomers are getting older and having more pathology, we're going to have to be forced to kind of manage this stuff. So it excites me to see where optometry is going in the future with this medical model.
For sure. And so in Oklahoma, you've got lasers and orals as well?
Oh, yeah, we have orals, and we're going to talk about that at SRC in late May. I think I've got a lecture on orals, antibiotics, and other medications. But yeah, we have orals. We have the ability to inject injections for anesthesia for lumps and bumps, injections of Kenalog or a steroid for chalazions, and then certain laser procedures, including capsulotomies, iridotomies, laser trabeculoplasty. We can even do refractive surgery in Oklahoma. We can do PRK. So right before I stepped on this conference call, I was seeing a 4-day post-PRK patient. I had done PRK on this patient 4 days ago. So wow. It's exciting to see optometry and doing these procedures.
It's great to have your enthusiasm and to be willing to share your examples at SRC. That's wonderful. Yeah. Dr. Malloy, what do you find inspiring about optometry at the moment?
I love optometry, of course, and I think the fact that there's now becoming so many different areas of optometry, it's not just, as Nate was saying, just, refract and glasses like maybe the old profession used to be. Now there's so many different specialties within the field of optometry, so definitely think that is something exciting. And especially myself, I really like neuro-ophthalmic disease, of course, and I feel that optometry definitely can do that specialty, because it's, for the most part non-surgical. And regardless of what state you're in, and regardless of the laws in your state, it's something that optometry really could step up and play a role in. So I definitely feel that optometry could, do more in that field if we keep expanding and training and learning more.
Yeah, when you think about it, students, both of us, that comes in, if you had a person that was 20, 21 that said, I'm interested in going into optometry, they could go down contact lenses, low vision, neuro-optometry, surgical. I mean, there's just so many different ways and roads and interests that you can choose. I think it's very exciting.
It is.
Yeah. Yeah, absolutely. You can find your niche, find something that you love, you're passionate about, and just keep going with it.
Yes, definitely.
Yeah, with neuro-optometry, Dr. Malloy, has there been something that's in the last 10 years that's changed, that you've been inspired about?
Well, it's not so much that the field has changed, but I think this is something that's pretty new for optometry for the most part. I've been doing this now for probably about 14 years. The specialty of neuro-optometry or neuro-ophthalmic disease. And there's really very few optometrists that fully specialize in this. So I think it's something that is just early in its infancy in optometry, but has a lot of potential for growth. So we started a residency program in neuro-optometry or neuro-ophthalmic disease at FAAO. We just started a few years ago. So hopefully with that, we can be training more people every year and who can go on potentially to train other people in the future.
That sounds awesome. And sorry, Dr. Lighthizer?
Nope, no.
No, that's great.
She's the specialist. All experts in the whole country, so I'm looking forward to listening to her at SRC about all her pearls on neuro.
Yeah, for sure.
Sure.
Tell me about, Dr. Lighthizer, you're talking about anterior eye at SRC. Could you give me a taste or an overview of some of the things that you're going to be covering, as well as you talked about orals already?
Yeah, so we're going to talk about, obviously, orals and prescribing oral antibiotics for a variety of anterior segment conditions, preseptal cellulitis, hordeolums, etc., things like that. Knowing when to prescribe them, which ones to choose. We're going to talk about, we're going to have grand rounds. So we're going to go into grand rounds cases on cornea and anterior segment. We'll hit on herpes simplex, herpes zoster, recurrent corneal erosions, a lot of these conditions that optometry owns. Optometry is at the forefront of diagnosing and managing these conditions, and we'll touch on dry eye as well. So a lot of anterior segment stuff where optometry is applying drops or orals for management.
For sure, that sounds great. And you're covering a little bit of electrodiagnostics as well?
Yep, we're going to talk on electrodiagnostics. I think I have an hour or two on electrodiagnostics. It's a topic I didn't know a whole lot about when I finished my schooling about a decade ago. It's an area that has evolved a lot over the last 6, 7, 8 years, and more people are introducing electrodiagnostics. It used to be made in the research center, big academic settings, big cities. It's been introduced a lot more for more common conditions, glaucoma, macular degeneration, diabetic management. So we'll talk about VEPs, visually evoked potentials. We'll talk about ERDs, electroretinograms, among others, and how to apply that to many of the patients.
It sounds really interesting, and it's an emerging field as well. And Dr. Malloy, what are some of the things that you're hoping to cover in your neuro talks?
So there's going to be a lecture just on pupil testing and specifics of looking for subtle findings of the pupil and how you really can learn a lot by checking the pupils carefully. So definitely a whole lecture on that. A lecture on neuroimaging, so looking at CAT scans and MRIs and looking for subtle abnormalities that are causing the patient's problems. Talking about double vision, and when patients come in with that, what's your differential diagnosis? How do you go about telling what the problem is? And all of these are going to be case-based, lectures. So, it'll tell you how the patient presented and how the thought process was and how we ultimately came up with what, the diagnosis was and what we did about it. And then Nate and I are going to do a lecture together about, is it glaucoma or is it some other optic neuropathy? So that should be something that's very interesting as well. And when you see your patient, how do you go through that process of deciding is it or is it not glaucoma? Whether or not they've been diagnosed with glaucoma 10 years ago, and you still have to figure out was that diagnosis right, or whether they're just walking into your office for the first time today.
For sure, yeah, it sounds interesting. So it sounds like whether you're an experienced practitioner or a relatively new graduate, these are things that, as optometrists, that we've got the scope and the capacity to treat and manage.
Yes, at least to diagnose, depending on what it is. Sometimes, obviously, they require something that's above our level. So often these patients might need surgery or something else, brain surgery or whatnot. But at least we know where to send them once we can figure out what the diagnosis is. And also understanding how urgent a condition is. That's something else we're going to touch on. When you see somebody, is this something that's a medical emergency and do you have to send them right to the emergency room, or what is the time frame that you need to do something? So that's also going to be very important because obviously that's the worst thing to do is to wait too long before you make a referral and, something happens that's unfortunate. So we're going to touch on that as well.
That sounds great. That's good to have that understanding there. And Dr. Malloy, Dr. Lighthizer, the anterior eye things, they're all things that we can be looking to definitely assess and manage pretty well, or refer to someone who has more specialty.
Yeah, that's correct. I mean, that's something in your primary care exam, your day in and day out, we're going to be seeing anterior segment pathology, whether it's a red eye, whether it's dry eye, whatever it is, and however it presents. I mean, to be able to look at it, diagnose it, what's the differential diagnosis, and how am I going to appropriately manage that? Yeah, we'll cover all of that.
Fantastic. That sounds really good. Well, there's only about 8 weeks to go today till the start of SRC, so we're really looking forward to having you guys come to Melbourne and to meet everyone. And hoping that you can get to explore some of the sites and get some good food, and look forward to meeting you guys.
We look forward to meeting you as well. I'm sure Nate does too.
Can't wait.
Yes, it's going to be great.
Yeah, that's awesome.
Look forward to it.
For anyone who's watching, I'll post a link in the comments below with a link to the registration so that you can sign up for SRC. But be sure to come along for Saturday and Sunday so you can hear both Dr. Lighthizer and Dr. Malloy and hear some of the great discussions. I'm a big fan of the breakfast session, so I'm looking forward to the Is It Glaucoma session from both of you guys.
Well, thank you.
Yeah, that's
Look forward
awesome.
to it.
We look forward to it, definitely.
Great. Well, thank you guys so much for taking time out of your Friday today. Really appreciate it, and we'll look forward to seeing you soon.
Thank you. Take care.
Thanks.
Have a wonderful weekend.
Thank you so much.
Okay.
Bye.
See ya.
Bye-bye.